All right, I appreciate everyone waiting. I am the last speaker. So either that's a good thing, because hopefully I'll sing, dance, tumble a couple of times, keep you all excited, or it's a bad thing because you're really hungry and want to go somewhere else. But what I would like to do to begin with is talk about one of the most overabused words in the healthcare industry. Artificial intelligence. 2 words, I suppose. Who's heard of it? Everyone, I assume. The amazing thing is, I talk to a lot of people and they say, well, hey, everyone does artificial intelligence. You do data analytics. That's AI, right? The reality is, artificial intelligence is not data analytics. And if you look at what is in healthcare today, it's data analytics. Data analytics is used quite widely. We've heard a lot about it in other talks that we've had today. However, true artificial intelligence is a system that can actually reason, a system that can engage, a system that can learn. And if you are not doing all of those things, I know it's white letters up there, if you are not being able to do all of those things, then you do not have artificial intelligence. So I just wanted to throw that out there because that's like an overabused word and I'll be abusing it some more. So, who am I? I am James Bates. I am the CEO and founder of AdviNow Medical, as well as the CEO and founder of ACOS Med Clinic. What is that? That is an artificial intelligence powered automated healthcare system. I've spent 20 years in the high technology field. Most recently, I ran most of Freescale here in the Valley that has now been acquired by NXP. And I had a very interesting experience talking to doctors and people who run practices, which really surprised me when I retired and was trying to figure out what else I was going to do with my life. The amazing thing I heard was that no one was making money. Did we all think doctors made a lot of money? Any nursing students or someone thinks that because you're in school spending a lot of money to get there. But the reality is, if you actually run a practice where you're seeing patients in your office, you're not making any money. Most likely, the people who work for you are not as happy as they used to be because you need to see more patients every day to be able to make the same amount of money you made last year. Why? Because the payers are paying less and less money for you. So what does that actually mean when you look at it? This is the Physician Foundation. A survey sent out to 10,000 doctors. What does it say? 80% of doctors will see no new additional patients. Who got sick or knows someone who got sick, wanted an appointment with some great specialist, but of course there was no time. Everyone in the room, I assume, has to have that experience. Why? Because that's the fact. 80% of doctors don't have time to see anyone else. Another very interesting fact is 21% of the time physicians spend is spent on non-clinical work. That means learning your HR system, training employees, anything that's not treating a patient or related to treating a patient. And that equals 168,000 doctors just in the United States. 17% of doctors today are solo practice, which is down 50% from 5 years ago, which means doctors don't run their own businesses anymore. Why? Because they don't make money, kind of what I talked about previously. And the interesting thing here, 48%, so almost 50% of that 17% are on the way out. So anyone in the medical field knows this. They live this. And they hate it. What I was surprised with is actually physicians were not enjoying their job. And this goes on to nursing as well, and I realize this is part of the nursing school. But the amazing thing is that it doesn't really have to be that way. What do physicians really enjoy? the most satisfying part of their job is the patient relationship. So as all of us in this room start thinking about technology, what technology are we going to be delivering? How are we going to improve this experience? Well, if you're a doctor, the only way they're going to view this as a win for them is if you allow them to spend more time with the patient, have a better exchange with the patient, and less time on all the other mess that they spend their time on. One more statistic, and then I'll go on to the actual purpose of the presentation. Doctors spend an average in primary care and urgent care, an average of 4 minutes in a consult. And if any of you have been sick and went to see the doctor, you can relate. 4 minutes. They spend an average of 12 minutes documenting your visit. So what does that mean? That means that they have now spent 3 times longer doing things that they hate than things that they enjoy. So that's the point. All right. Well, what does this mean for patients? We've all seen the churn. An urgent care center opens here, then it shuts here, then it opens here. Every week there's a new one showing up on your corner, and the next week it shuts down. There are no stable places to go get that care. And what ends up happening is if you go through all of these, and these are small numbers, so I won't really talk about it in detail, it takes you longer to get served, both waiting for an appointment as well as in the waiting room, than ever in the history of the United States. This is the reality of healthcare. And patients, all of us in this room are patients, everybody is a patient eventually, we're angry. Why? When you get sick, you go to Google. Dr. Google says, hey, I've got a sore throat, I've got a sick stomach, and you look it up and pretty much you figure out you're going to have brain cancer and die, because that's what you find out on Google. And then you go and say, well, I do have health insurance, what do I do? So you go to their website, then they tell you to go to this doctor over here, you look it up, and of course that doctor doesn't practice anymore. That's what I talked about on the previous slide. So then you're like, wow, where do I go now? So then you think, can I go to an emergency room? Well, not really, because then you don't get paid. You end up paying that big bill. The insurance company doesn't cover it, and you are just angry. So, that trend, this is a reality. And this is from the system that is out there today. It's not because doctors want to do that, it's because they have no choice. There are less primary care providers in the world today than there were last year. There are more retiring every year than are joining the field. At the same time, you guys have heard of population medicine? That's the idea of a group like ASU students managing this population's healthcare costs to bring the total costs down. Well, to do that, you actually need to have more primary care visits. You need to take care of the population before they get sick. And that's combined with a trend which says people want to spend less time in the doctor's office. They want to spend less time managing their health. This is why healthcare tech is so hot. This is the big deal that all of us in this room are trying to capitalize on. When there is a need, there is opportunity. The way I look at it, and how I started AdviNow Medical, I don't see the government, companies, or families saying, you know what, I want to pay my primary care doctor more money. I want to spend more money on healthcare, not less. I just don't see that happening. Maybe there's 1 or 2 people out there, but pretty much people are upset with that they're spending $1,000 a month on health insurance alone. So you're not going to pay them more money. I don't see doctors who are in demand, who are frustrated by the whole system altogether. I don't see them saying, you know what, you can pay me less and I'm okay with that. I don't see that happening either. Automation is really the only answer. So what does automation mean? And this is where artificial intelligence starts mattering. Every single repetitive task that's out there, every one inside a clinic needs to be automated. The care coordination. How do you decide where to go, when to go, and who to see? Registration, insurance, medical history, the original collection, that big stack of paper you get when you walk through the door. The history of present illness, the Q&A the doctor or nurse will do with you. The medical measurements, you can automate those with augmented reality. Electronic healthcare record, that terrible thing that I told you took 3 times longer than the doctor actually seeing the patient, that can all be automated. The notes the doctor writes to justify why you came to see them and what they're going to do about it. That's SOAP, subjective, objective assessment and plan. Discharge orders, scripts, coding, and follow-up. This is all repetitive. And if you have a true artificial intelligence, it can be automated in a way that actually makes it easy for people to use. Now you say, wait a minute, what does the doctor do? For the first time in probably 20 years, a doctor is now a doctor again. They're not an EHR expert. They're not somebody who says, I know that this payer will not select this drug, so I'm going to prescribe this drug. They're not the payer expert. They're not the coding expert. That's H.0013, not H.0012. They don't need to know any of that. All they have to know is, this is the symptoms you have. This is the objective measurements I've taken. And this is your illness, and this is the best way to treat you. They get to make that decision and focus on the decision, and it fundamentally changes how medicine is practiced. So, with that backdrop, I'm going to inflict a commercial on you, which I apologize for ahead of time, but here it is.
Meet Dr. Garcia. He runs a family care practice. However, every day he comes home exhausted and too late to enjoy time with his family. He gets in the office early for staff meetings. Then he sees patients all day, sometimes skipping lunch. After closing, he turns his attention to medical charting and filing reimbursements. To grow the practice, he has to work long hours. This has taken a toll on his health and family. Dr. Garcia decided there has to be a better way and found AdviNow Medical, a healthcare technology company. AdviNow Medical offers a solution through Hannah, a virtual provider assistant that operates on an artificial intelligence diagnostic engine. Hannah, the VPA, helps the patients take their vitals through an augmented reality medical system. She automates the practice, doing all the heavy lifting so Dr. Garcia focuses on the patients. Now when the practice closes, Dr. Garcia goes to spend time with his family. No need to worry about charting or medical billing, as all of that was handled by Hannah after each patient visit. With AdviNow Medical's virtual provider assistant, Hannah, Dr. Garcia reduced his operating cost by 35%. He increased his revenue by 50% because he had time to see more patients and accurately bill for the treatments. Not only are he, his staff, and patients happy, he gets to see more of his family. If you are a provider or a medical group,
Dr. Garcia is a happy man. What does that actually mean in terms of numbers? The idea for this company actually came about when I had an acquaintance of mine come up and suggest I buy a chain of urgent care centers here in Phoenix. When I started analyzing the finances and understand how urgent care centers work, I saw this trend, this blue line here. The x-axis, this is patients per day. The y-axis, that's the profitability of the clinic. And what you'll see there is the zero crossing is at 24 patients a day. And you say, okay, you got to get 24 patients a day. Roughly, this is a 12-hour day in an urgent care, 2 patients an hour. Okay, I get it. Kind of makes sense. Then you go to the wait time graph. And at 24 patients a day, during peak hours, the average patient waits 40 minutes to be seen. 40. We've all endured it. If you go before school, at lunch, after work, after school, if it's only 40 minutes, you're doing pretty good. By definition, if you have a profitable urgent care clinic, you have poor customer service, and there's nothing the practice can do about it. I saw this and I'm like, dude, I'm sorry. I am not interested in investing in buying this clinic. It's broken. For 6 years in a row, the payers, the insurance companies, were paying less money per patient to see a patient, which meant every year they had to increase the number of patients they saw every year just to break even. This was an analysis done with 2015 numbers. The numbers for 2018, you have to see 28 patients a day to break even. That trend is only getting worse. So what does that mean? Well, take Dr. Garcia there, that wonderful AdviNow system, you throw that in the mix. This is that orange line. Now, you can see this only saves 20% cost reduction in this model. Why? Because in an urgent care, you go from a 3-person down to a 2-person. So you're only really cutting costs of 1 person. And then you're adding software costs. Our software is not free. We do charge for it. And so you end up saving roughly 20% off the top. Where's the real difference and why does it matter? When you look on the right side of the screen, this is patients per day. At the break-even point of 20 patients, you now have an average wait time during peak hours of 10 minutes. You can scale that up to almost 60 patients a day and have an average wait time during peak hours of 30 minutes with 1 doctor. When you think what this happens to a practice on the profitability side, you can now scale without adding another provider. That's that big little check mark there that drops it down under profitability again. It changes the game for the providers who are actually running a clinic. And this is why Dr. Garcia was a little bit happier. Dr. Garcia has the friend of Hannah. She looks a lot better than I do, which is why you throw her picture up there. But how does it actually work? You've just seen the results. Technologically, what does it do? Well, it all starts with an app with care coordination. We have a partnership with Safeway. We actually had a nice big announcement yesterday at the Tempe facility. We had coverage on all the major stations, so I feel, pretty happy at the moment. Every Safeway that's available will have an automated medical clinic inside. Coming soon in the Safeway app, when you're sick, you will go there. You will enter your chief complaint, and it will do a complete patient interview and decide one of 3 paths for you. It will tell you where to go. No more going to Google, deciding you have brain cancer, and then going to the ED to find out that you had a migraine. It's going to decide, do you need a lab? Do you need objective measurements like blood pressure, temperature, a stethoscope exam on your chest or lungs? Do you need that to be clinically diagnosed? If you do, it sends you down this middle path. Do you need a doctor to palpitate your stomach or your abdomen if you have abdomen pain? Do you need a doctor to do a procedure like sutures? If that is the case, it sends you here. Or if it does not require any of those things and you can be seen over telemedicine, awesome. We'll see you over at your home on your couch. Here's the problem with standard telemedicine that doesn't do this. I know I may upset half the people in a room, and I'll apologize ahead of time. There's no such thing as diagnosing an infectious disease over the phone. It's just wrong. And if a doctor's going to tell you, I can guarantee you have strep throat by talking to you over a Skype call, that doctor's lying to you. Now, there's pretty good doctors who have guess capabilities. They have lots of experience, and they can really get a pretty good probability that, yeah, they can diagnose you. You probably have something. And maybe they're right the majority of the time. That is not objective medicine. without the measurements, without the labs, without getting a rapid strep test, without doing a throat exam, without checking your temperature, how do you really know if you have strep throat? So when you're getting that antibiotic over that telemedicine call, you're doing yourself a disservice by not being truly diagnosed. So what does this mean? This means this is the first telemedicine app that can guarantee truly objective medicine in a very convenient way. And this is what it looks like in a video. And you'll see our favorite model out there is out there by our system if you want to go out and look at it later. This is the Tempe clinic in the Safeway that we had the grand opening at yesterday.
Hello.
Hi, welcome to AdviNow. My name is Janice.
Hi Janice, I found you guys on Google. I'm not feeling too well, but you guys are pretty close.
Okay, have you been here before, or are you considered as a new patient?
I'm probably a new patient.
Okay, so we're gonna have you register onto this tablet. Do you have insurance and ID?
I do.
So you're gonna go ahead and put that information into the tablet, okay?
Oh, okay.
So
Thank
go
you.
ahead and have a seat and fill it out over there.
Okay, thanks.
The patient starts the exam and basically goes through a whole differential diagnosis on a mobile device, in this case a tablet if they didn't pre-register from home. And all of this work is done where they're sitting in the waiting room. 0 wait time so far. The music's too loud, sorry. I got the dancing going. I was reminded I promised dancing. We do an insurance verification immediately, as well as take payment over credit card before the patient gets done with their sitting. If they need to pay by cash, they will pay by cash with the medical assistant. You have your standard medical history. This is the same stuff that you usually see in the big pile of paperwork you're handed when you walk through the door. This is the chief complaint entry. Any complaint you have on any part of your body could be entered. Now, it's asking questions. Ear pressure, pain, what makes it worse, what makes it better? These are the same questions that you would be asked if you were seeing a provider in a room. Now the system is determined. It is basically converged on an illness, although it needs objective measurements to know.
Awesome. Did you get a text confirmation code?
I did.
Great, so we do have an exam open, so we'll start your
The patient goes in and sits down at a kiosk, which you can see outside in our demo, that has medical measurement devices. Using augmented reality, the patient can either do the measurements on themselves or a medical assistant can help them. This is a screenshot of what the patient sees. Facial recognition, we need to guarantee it's the same person. There is that nice little floater there. Hey, put this device here. We use machine vision to guarantee it's in the right location before it will accept the measurement from the patient. Stick it in your ear. We then use machine vision from the stream here and the guidance of tilt tip up, left, right, follow this, move tip left, move tip right, up, there's the eardrum, and you now have a perfect image of your eardrum that the doctor will review before they ever see you. We need a heart exam and a lung exam. Put it here. Put it here. The system will be listening for the sound the doctor is expecting. Once they hear that sound, once the AI basically, and it learns every time it listens, confirms that sound, it will move to the next location. Same thing for lung. Except here, breathe deeply is now part of this system. And of course, the wonderful throat exam, which everyone loves to see, comes up next. Very beautiful. But again, using augmented reality, each of
Good
these
day,
medical
Dr. Gar.
devices
How are you doing
is easy
today?
to
Doing
use.
all right.
You then have a
I have a little ear
telemedicine
pain,
call
though.
which starts up.
I'm
Now
sorry
the
to hear
doctor
that.
has
I am
objective
Dr.
measurements,
Grayson. I will be taking care
a
of you
list
today.
of illnesses. This is what the doctor sees on this
I
side
will
of the
start
screen.
reviewing your symptoms. Looking at the previous history, it seems like you have some allergies but are otherwise healthy. Looking at the vitals we're taking today, I can see that there's a slight fever, but nothing else is showing up and everything seems normal. If I start going to
This is a
reviewing today's
list
symptoms,
of every
I see that we have
single
an
question
ear
and
pain,
answer, every measurement the patient has
and
taken. How it
there seems to
correlates
be some
back to the
problems with your
disease
hearing
based
as
on
well.
peer-reviewed data that the provider can confirm and
is that
check.
correct?
All of the
Okay.
images that were taken by the patient that are relevant
Can you speak up
to
louder?
this disease.
Okay, no problem. I am reviewing the images that were taken from your ear, and I see a slight bulging eardrum. There's
Okay.
some information, and this is probably indicative of an ear infection.
You've been having some like pain inside, it feels like, and swelling.
So for that, I will prescribe you with a treatment to give you
So now the
probably an
provider is
over-the-counter pain
confirming
medication.
the diagnosis. Yes, this is an ear infection. I've looked at the temperature. I've looked at the ear. I now have all the objective and subjective information that I need to do to make an
The
assessment.
antibiotics that I will
The
prescribe for you
AI
is
predicts the most effective
amoxicillin,
treatment
and I will also
based off of all
prescribe
of
you
those
some
symptoms,
ibuprofen
all of
to
the measurements that were
ease your
taken.
pain.
This is the treatment plan that
Could
will
this be
lead
allergy
to the patient improving their
related?
health faster.
It might be. You might also have had an infection lately. I don't know if that's the case.
I
This
haven't
is
been
what
feeling
ends up
too
in the
well. I don't know
EHR.
if it was a full-blown cold, but
The automated scalable clinic truly has an opportunity to allow a provider to see 3 to 4 times as many patients per day as they see now, while actually spending more time with every patient. And it's done simple care coordination, automated registration, an AI-driven patient exam, a curated working diagnosis the provider reviews and confirms with the patient through a short telemedicine call. If you look forward 5 to 10 years from now, I can't imagine a single office visit that does not have you engaging with some type of artificial intelligence before you see the doctor. The return on investment for the providers to enable a system like this is just too great. I can see 4 times as many patients and I don't have to do all the stuff that I hate. When I look forward in medicine, a lot of people have grandiose ideas of a robot that's going to go out and fix everyone, like, Big Hero 5. But what's more probabilistic is an assisted system that lets a doctor do an assessment and a treatment in such a short amount of time that they can see as many patients as they need to see to bring the cost down, enable care to anyone. Eventually, for most illnesses, the AI assessment will probably be sufficient someday. I imagine we're probably 10 years away from something like that. But in the short time we have, we can gather all of the measurements that are required using augmented reality. And what I didn't show is stuff like ultrasound. Imagine being able to take your own ultrasound and getting a perfect ultrasound done every time. The provider has a complete list of illnesses with probabilities associated with them to determine what's wrong with the patient. If you can imagine, 2 minutes. If you can imagine your doctor now just spending time with you, confirming what you already put in the AI, you could imagine the future. The painful electronic healthcare records that are part of the system that we have today also go away. Why? Because the patient is filling them out. Really, after an interview with the AI. 20 years from now, we will follow the path of radiology. When I was a kid, they still had film. I'm an old guy. And there was a radiologist in every location. And that radiologist had to read and come back and tell you. Today, the reality is the majority of the radiologists basically kick back in a wonderful system like that, and they see hundreds of images a day that they diagnose. And they actually get paid quite a bit. The FDA has now approved AI to actually complete the assessment of these radiological images today. This is the future of point-of-care medicine. It'll allow doctors to spend time where they need to spend time, not in places that add little value. Thank you very much.